Good morning, everyone. Welcome to our Lively U Virtual Learning Academy. On behalf of the Wood County Committee on Aging, we're presenting the topic Management of Arthritis. We welcome Dr. Valeriya Kochina here from McLaren St. Luke's Family Medicine Residency. Thank you.
Hi, good morning, everyone. As she said, I'm Dr. Kochina. I'm one of the residents here at the clinic, and I'm just here to kind of do a broad strokes talk on arthritis, mostly osteoarthritis, as that's the most common one. There are multiple types, but we'll just focus on one for today. So what is arthritis? Arthritis is the inflammation of the joints, any joint that you've got, and it is one of the most common causes of disability. It actually affects about more than half of everybody over 65 in this country. And as we said, osteoarthritis is the most common kind of arthritis and is caused by the breakdown of cartilage in the joint. So basically every joint that you have, there's two bones, and between there's a nice little cushion. And throughout our lifetime, that cushion gets damaged, whether it's just by use or trauma. And sadly, you know, the more full of a life you live, the more damage those joints kind of take on. And that breakdown of the cartilage can cause pain, stiffness. They're kind of harder to move. You get less range of motion, and it's a little bit harder to use those joints. And as we were saying earlier, like, how do you get damage to those joints? Using them will kind of do that. So, you know, the more years you kind of count up and the more active of a life you live, the more damage there is. If you've ever had any kind of injury there, whether it's a fall or kind of a hit to the joint, anything like that. And if we tend to carry a little extra weight around, that does cause more damage since you just have more pressure on those joints, causing that cartilage to take on more trauma with kind of every movement. And usually osteoarthritis can just be diagnosed by a physical exam at your doctor's office. They'll usually take a pretty extensive history. They'll ask you kind of when in your day your pain is, what makes it worse, what makes it better, how long it's been going on, and they'll do a full physical exam of your joints. And that's usually enough to make a diagnosis unless there's something out of the ordinary, and then they'll kind of go a little bit deeper with that. And the treatments for osteoarthritis are kind of three-pronged. There's medication, exercise, and weight loss if that's appropriate for you. Now, they all kind of do different things to help you out, and half of it is from your doctor's side and half of it is from you as the patient. It's kind of a team effort. So exercise will kind of work on flexibility of those joints and maybe decrease some pain. There's also the option of OMT. So I don't know if any of you have heard of OMT before. So there's two types of physicians. You can have two different degrees. You can have an MD degree and a DO degree. The training for those two degrees is the same, and you take the same board exams and kind of do the exact same classes. The DOs have to do an extra training course in OMT, which is osteopathic manual treatment. And that is a more hands-on approach where they'll kind of do a full assessment, see if there's any changes in your bones, muscles, tissues, and kind of target therapy using either your own muscles or more of a relaxation technique. So that's always an option if you do see a DO or you go to a practice that has DOs. It's usually covered by your insurance and kind of allows you to get closer to your baseline so that when you do things like exercise, you are starting at a more kind of normal, you can say, place rather than having to overcome all the pain you're already in. Now, if you want to go for the weight loss approach, that just reduces that stress on those joints that we talked about, causing them to just have less trauma each time you move. Now, I don't know if anybody's ever told you to use like heat pads on your hands if you have hand arthritis. That can kind of reduce some pain. Now, from the medication standpoint, you can do things like Tylenol and ibuprofen and Aleve, and those are appropriate if you are using them frequently, though, like every day. I would talk to your doctor, since those do have their own side effects. If you use a lot, they'll need to kind of watch out for your kidneys and your liver. And then you have the options of different injections that you can do at a doctor's office. So you have lubricant injections or steroid injections. And if any of you have had the steroid injections, you know that there is a timeline that you can get them on, because sadly, even though steroids improve your pain, they themselves are also causing damage to your cartilage, which is why they have to space them out to make sure you're not actively damaging the thing you're trying to improve. And then there are other things kind of on the side that you can talk with your doctor about, things like acupuncture. There's different supplements. There's Tai Chi and yoga. And although, you know, you can't have extensive research in those things, sometimes they help people, and you kind of have to do a risks benefits conversation, but those are always available. But sadly, the thing that causes pain is also the thing that over the long term will improve your pain. So exercise is kind of the big thing. As long as you can keep moving, you can kind of improve your pain and range of motion of those joints, so you won't have as much of that stiffness with the pain. Also, exercising releases all kinds of hormones and chemicals, and those help your mood. Those help you get better sleep at night. And sadly, exercise is one of those cycles. So if you exercise more, you have more energy, which means you can exercise and move more. And then the opposite cycle is also true, which is why people always recommend more movement rather than less movement. And it also helps with that weight management component that I previously mentioned. Now, the types of exercise you can do are basically any of them. So range of motion exercises, any kind of stretching will work on getting a full motion in those joints, which kind of keeps preventing that stiffness and the stiffness of the muscles around it. And it'll improve your flexibility, which will let you move some more. And then strengthening exercises, so that's any body weight exercises or dumbbells or anything you got, mostly because if you can build up the muscles around the joints, then you kind of unload those joints a little bit. So anything we can do to get less pressure on the joints is kind of our goal. And then endurance exercises, that's like walking, swimming, things like that. Those are just good for you because they help your lungs and your heart work better, which means you can do more, and then you get back into that cycle of benefit again. So sadly, osteoarthritis is one of those things that come as you get older and wiser. And the main thing you can do is just keep moving and talk to your doctor to make sure that they're doing everything they can to make sure that you're able to move as much as you can. And it's kind of a big team approach. So if you guys have any questions.
I'll go ahead and allow everyone to unmute themselves if they would like to. And share any questions you may have. Does anyone have questions?
I have a question.
Sure.
Is it true that certain foods could make better or worse? Because, and then of course the weather.
So I've definitely heard about the weather. I know people feel that. Sadly, it's one of those things that's really hard to study. So you will never get an actual published paper on that. But I think especially the cold will do that just because it's more of a muscle reaction just because it kind of tenses everything a little bit. And then with food, there are some theories out there that the more inflammatory foods will cause some more pain. And then so certain things like turmeric, I've heard help some patients. So yes and no, it depends on the severity of your arthritis. If you can get any benefit from maybe switching some foods around, and certain spices like turmeric, I will say if you're adding them to your food, that's probably appropriate, and you can always try that. If you are taking supplements, I would talk to your doctor first because sometimes those supplements have other things in them and they tend to interact with a lot of medications that people are on. But there is a theory that some foods that are inflammatory in people who are very sensitive to that can make your arthritis worse.
Thank you.
Great. Does anyone have any other questions?
Yes, I'd like to ask about the use of heat on the areas. I find that at night in particular, I have a lot of pain in my lower back and my shoulders where the arthritis is located. And I find that a heating pad seems to give me relief, but the arthritis does keep me awake a lot of the time at nighttime.
Mm-hmm. And yeah, heat is actually very good for arthritis management. So if you're using a heating pad or a water bottle with hot water to even just to hold, kind of at 15-minute increments, that's okay. Just make sure you're not burning yourself. Sometimes it feels too good that you forget that it's hot. And if you want it for a longer time, you can even take turns. Like you can put some heat on your shoulders and then go to your lower back.
Okay.
Yeah. If you're having trouble sleeping with the pain though, I would talk to your doctor because they definitely want you resting, because if you're not rested, your pain will feel worse.
Okay. Good advice. Thank you.
Great. Does anyone else have any questions?
No, I deal with this. I've dealt with this. I've had 3 hip replacements. I got DDD. I've had 4 back surgeries. I'm full of hardware. I have arthritis all over shoulders. And I also deal with fibromyalgia.
It sounds like a real struggle. I'm really sorry.
Yeah, but
you probably have all the tricks.
I try to walk. I still walk. Of course, I have to use my cane. I still walk slowly every day, and I still do the hip and back exercises. And I don't get to sleep till 3, 4 a.m. And that's because my mind's moving from the fibromyalgia.
Mm-hmm.
So, but my doctor's a DO, so yeah.
Yeah. Well, I'm glad you're still moving around. I think that's the best.
Yeah, I mean, it may be slow, but there's days that if I'm in a flare up, I can't do anything. Yeah. But, life goes on.
Yeah.
Thank you. Wondering too if you would recommend like water therapy.
Yep, and that's part of that in the endurance exercises. I think water therapy is actually, if you can do it, is spectacular. It works really good on flexibility, and it is kind of like a cardio workout as well, but you get the benefit of not putting any pressure on those joints while you're doing that workout. So you get the benefit of a workout without any of the maybe side effects of putting the more stress on your painful joints. So it's a great idea.
Also, do you think that individuals that have arthritis tend to move less and maybe eventually more at risk for falling?
I would say yes. It's again that kind of cycle. So if you have arthritis and then you have the pain and it causes you to move less, you not only get less range of motion in your joints. That already makes you feel unstable. You also start to lose muscle mass, which doesn't give you the strength you need to kind of keep the balance that you need. So you're kind of, there's many different things that go on in making you feel more unsteady when you have severe arthritis.
Thank you. Is there any other questions?
Yeah. Yes, I do. My bones break very easily, and my doctor put me on high doses of calcium and vitamin D. And I'm wondering, does the calcium help decrease the incidence of joint inflammation?
Usually the calcium and the vitamin D are more for osteoporosis, which is that kind of fragile bone that you're talking about. So it works more on the actual bone structure rather than the joints between the bones.
Okay, all right. Thank you.
Okay, wonderful. Any other questions from our participants? It seems like we had some good information, some great recommendations. And it's always nice to hear what other people are doing and what's working for them to make it helpful. So I want to take this opportunity to thank Dr. Kochina for sharing this information with us today. And we look forward to our next presentation in September. So thank you once again.
Thank you.
Thank you for having me.